Hello and welcome to ETGovernment Chai Pe Charcha. This is a special program that we organize every week wherein we interact with a new guest discussing interesting topics. For the first week of October, our guest is Mr. Shafqat Khan, who is currently serving as the OSD in Health and Medical Education Department with Government of Jammu and Kashmir. In a career spanning over 20 years, Mr. Khan has established himself as a top public sector leader with an extensive experience of administration cutting across a wide variety of sectors, including healthcare, urban development, e-governance, and solid waste management. Mr. Khan is an alumnus of prestigious Osmania University, Hyderabad. He graduated in medicine with master's in health management and worked in key positions in various organizations in the state government, as well as he was the commissioner for the Municipal Commissioner of Srinagar. He was also the Joint Commissioner for a Special Cell for Migrant at J&K House in New Delhi. Mr. Khan is also credited to have prepared the Smart City project for Srinagar and got it approved by the central government. He specialized in e-governance and digital transformation and solid waste management. Mr. Khan, welcome to Chai Pe Charcha.
Hi, thanks for having me today.
Right. Let me begin by asking you. I believe you began your journey way back 20, 18 years ago. Can we start by just asking you how all it started? What was the motive behind coming to the government sector? If you could share something from the beginning.
You know, basically, when you enter into government service, typically you get into a different variety of streams, and those times you would just get in by chance. But I think government service is not getting into service by chance. It is
Right.
about a huge commitment. It is about having the zeal to, serve as a public servant. You have to always keep in mind that you are a public servant, and a public
Right.
servant is a person who has to serve the public. It's a
Right.
very dignified way of describing a public servant, but you have to serve the public. You have to keep that in mind always. And I think my primary logic of getting into government service was to serve the public in whatever capacity I would be, wherever I would be posted in sunshine and in the shade, or wherever, how government services, there are ups and downs. But wherever you are, you can, contribute a little bit here and there in small or big way, but that should be your basic motive.
Right. So how all it has started in the beginning? If you could share something from your childhood, your college, and maybe for some exams that you gave, how it all started.
You see, basically, I was a cleanliness freak. They used to call me at home. So, waste management, garbage was a very touchy issue for me from the very beginning. So that garbage and that kachra, being so close to my heart, the safai wala being so close to me every day when he used to come collect garbage, I started implementing. Using my mind into how where this garbage is going, what they would be doing with this garbage, how we could get rid of this garbage, and these questions, kept crawling into me every day. But then I saw that our hospitals would be not so clean, they would have issues of sanitation. And I primarily thought that if I get into public health sphere, I will be able to, see what is the reason behind hospitals being not so clean and how we could make them clean. So I did my public health this degree, but then with a degree, a degree is not enough for a person, to say, "Okay, I have done it, You should have that capacity, that heart to understand that subject which you are doing, which you have specialized. You have to
Right.
put your entire heart, your mind into it. So I luckily went into the municipal corporation primarily as the health officer of the city. and
Right.
the registrar of births and deaths. So I got a chance to interact with Safai Walas, to interact what tools they were using, what techniques they were, and those were very harsh techniques, the way they used to lift garbage in those hand carts and then pull those hand carts. There would be broken hand carts. There was nothing, no protective gear they used to wear. Anyway, somehow I was able to, make small changes in the outlook of the garbage management of the city. And then I served as head of a couple of hospitals in the Srinagar city, which also changed, And I was lucky, I don't know, it was a lucky coincidence that when I was medical student, then I left the hospitals, the infant mortality rate of J&K fell by 10 points. I mean, we were at somewhere at 36, then we have reached now at 22. And now latestly we are at 16. So saying that in those 2 years, I worked in two critical hospitals in Kashmir Valley, where most of the deaths would take place, So, but I overhauled the two hospitals. One was the children hospital, and another was another super specialty hospital. So I changed the entire sanitation apparatus of the city, not only the bathrooms, the overall mopping and cleaning, but the solid waste management and the liquid waste management, the sewage treatment plant, and lifting of garbage by private agencies. So trust me, it has all started with garbage, basically. And I still believe that garbage is the futuristic element of all societies. They'll have to start thinking as to how to,
Right.
dispose this garbage scientifically, how to dispose it responsibly at household level, how we should equip our garbage handlers, the safai karamcharis,
Right.
and what machinery is needed at what level to
Right.
reuse, recycle, recollect it, put it to different use, and to have machinery where garbage could be used as fuel also. There are garbage to waste to energy plants in many countries now. And people produce electricity from garbage.
Right.
So that was a little, kick off when I started this. Then I became the nodal officer for the smart city project of Srinagar. We had consultants coming from Delhi, and these gentlemen started, and in the peak of unrest, actually, we started this project, and everybody thought that Srinagar would never get smart city because, this project would never get approved because the condition is not conducive. There is
Right.
unrest in the state, in the valley, and different reasons. But luckily, despite having unrest for 6 months,
Mhm.
I personally sat with the consultants in that room and gathering information, sending brochures by physical brochures to different households, and various techniques by which finally we
Right.
were able to get together a small smart city project.
Right. Right. I'll come back to the smart cities. I'll go back to your answer which you gave around the waste management. Um, what we noticed that across the country there are municipal corporation, urban bodies, and they are doing a lot of experiment in terms of using technology, using sensor, using some innovative method of pick and drop for garbage recycling or garbage management. Would you like to share based on your experience as to how in Kashmir, while you were with the Municipal Corporation of Srinagar, what kind of innovative method you opted for? Uh, because I was very recently in Arunachal. What they did, they started using some tag and some technology which is sensor based technology which was able to actually tell them where to pick and where to drop.
We have to first cultivate a method of respecting the Safai Karamchari,
Right.
at the household level and at the official level too. Once you invoke that amount of respect for a Safai Karamchari, you will understand what his needs are, what he requires for him to lift this garbage nicely, take it to the designated spot, collect it, and finally it will go to wherever it leads. Most of our cities, when you start from baseline, people will say there's a dearth of Safai walas.
Right.
The city does not have enough Safai Karamcharis. So what we did is we made sanitation clubs. For suppose for 50 households, we employ a person who will collect this garbage, and each household will pay 100 rupees a month, and it will generate a salary for the person. Once you are paying for the person who is lifting your garbage, you are generating income for him, a way of livelihood for him, and you are generating a way to handle that garbage. That's one. Number two is the responsibility of the municipal corporations and the municipalities to give the right tools to that Safai Karamchari. Most of the Safai Karamcharis do not have the required, the Safai broom or the other equipment which is needed for lifting of garbage. His hand cart is almost all the time broken. Most of the time it is a hand cart. But now, when you say of revolutionizing things, what we did was we inducted a fleet of small vehicles which would go from house to house with a speaker on and with a small ganti, ting, 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 that
Right.
siren sort of thing, which will sound outside the house, and the household people would come out with the garbage and put it in the vehicle. So one element was reduced immediately. That Safai Karamchari plus his small hand cart, or the cycle cart was out. Then these small vehicles would carry this vehicle to a larger vehicle and
Right.
empty that vehicle directly into the larger. That is a garbage compactors we use. No, those are garbage compaction vehicles where they compact the garbage, the volume becomes less, and then
Right.
they take it for final disposal. So Srinagar first time saw a force of Safai walas, which was number one, uniformed. You have to, uniform. We put those sleeveless jackets, hazard jackets onto Safai walas, red, yellow, green color, because you should recognize that he's a Safai Karamchari and he is from
Right.
the municipality. Number one. Number two, we respect him, give him adequate uniform plus gear. We protect him with hand gloves, masks, whatever is needed. We look at his health status. We see if his occupational health hazards, related to his health. We give him the number of vaccines required, a health checkup if required. So I think these small things need a huge heart,
Right.
to do to revolutionize. And ultimately, by mechanizing this entire garbage collection cycle, we were able to get a huge breakthrough, huge in the huge sense,
Right, absolutely.
and
Earlier, you were mentioning about the smart cities and some challenges initially that you face in terms of, somebody just thinking whether a small city like Srinagar could be actually turned into a smart city, could actually get into the list of a smart city. So, what was the challenge initially, and how did you manage to get into the center list?
the challenges are, in garbage that nobody wants to own the garbage. Once it is out of your house, you want to throw it outside, and then you don't want to think about it. You largely tend to, be responsible only when it is within your house, within your four walls of your house, isn't it?
Right.
Then
No,
once
no,
you throw it, you say it is not my
I was
baby.
I was referring to the smart city project primarily. That a smart city project that you initially envisaged, there was some sense of understanding that uh, Srinagar being a small city, possibly there will be some challenge to get into the central list of a smart city, and you were able to get it done successfully. So how did you do it,
Yeah.
and what was the challenge initially on a smart city part?
The smart city project, once it was done, and there were these smaller issues and the larger issues which were trans city issues. So transportation was one issue. Solid waste management was issue. We had the area based development. So our crux of the smart city was that there are two parts of the city of Srinagar. One is the old city, which many of us here called Shahre Khas, and there is
Right,
the new city. The new city, there are people who come from rural areas and settle in the city. So in Srinagar, we have a distinct divide between the two cities. It's not like Delhi or Mumbai, but
right,
Srinagar, actual city is based on the right hand side of River Jhelum, and the new city is based on the left hand side of the River Jhelum. So there is a distinct difference between the people living in these two areas. One, they are called from, Gaon ka. Other, they think they are the natives of the city. So
right,
I said that we should link the two parts of the city together. That is the old city, the Shahre Khas people who think that belong to the city, and those who have traveled from the rural areas and become the city people. So we said we will open more routes, water routes, road routes, and beautify the old city, the Shahre Khas into a way that everybody goes there and for shopping. They start going to that part of city to interact with people. If you have to get copper utensils, which we used to get, you go and get copper utensils. They say in our old city there are spices and condiments. There are paper mache. There is cottage industry. So the new part city people should interact and go to, and we should open up all the ways for them to go, and interact with those Shahre Khas people. So we did that by utilizing the river Jhelum. We said we'll have water transport. So somebody sitting on the left hand side of Jhelum will straight away go in a water transport mechanism to the old city and be able to get back without facing hassles and traffic. And
right,
to make old Shahar Khas so beautiful that it attracts people from the university. That was the first crux of the challenge of making the smart city. But as I told you, in the first instance, the first challenge was that in 16 there was unrest in the city and the valley. The things were not conducive. 17 also was very difficult. But then we finally got into making of this project. We submitted to the government of India, and Honorable Vice President right now, Venkaiah Naidu sir, he was the Minister of Urban Development that time, and I presented that to him. And he was so happy to hear our project that later, when the committee sat, they gave smart city for Srinagar and Jammu also. Both the cities went for the smart city approval, and we were very lucky. We still consider ourselves very lucky to have the smart city project, for
right.
Srinagar and Jammu as well.
Right. So how is the situation right now? As you said, in 16, 17, there were some challenges, and because of that, there was some delay happening. So how is the situation right now? You have approval for Srinagar and Jammu as a smart cities. So has anything been done? Do you see something happening despite the fact that you are not part of that particular department anymore now? But do you see some tangible changes happening on the ground?
Yes, that's a very nice question. I feel that, when you go out and see down the city that what you conceived in your mind or what you proposed, how it is being implemented, I think certain things are being done very nicely. And certain things, because of 18 beginning, some months we were in a phase of, transition from the state to the UT. I think now, after that, things have started moving very fast. In fact, in a much better and much prompt way, and the things which we perceived are seeing the light of the day. Srinagar city is a city of light right now. It used to be, very dark, the alleys, the main roads. Now it is a lightened up city. The Dal Lake, when you visit in the night, you'll see that the footpath, which is very nicely put, the lights are on. There are certain places where we had proposed bicycle tracks. Now they are doing the bicycle tracks also, walkways. Then Srinagar, main city area-based development is also taking off very soon, I think. And I see that in the old Sharik House, some development is already visible on the roads. The city footpaths are getting better. I think there's a lot more to be done, of course, but I see a lot of things happening, and it is a very good sign. And when your dream or when your ideas are getting into reality, you can see them on ground, and that makes me very happy.
Right. And I'll come to the COVID part, which is directly related to what you are doing right now in the healthcare department as a OSD. What we observe across the country that most of the organization is struggled with the pandemic, both the first one and the second phase. And second phase was were a bit more challenging compared to the first one. So how has been your experience, and also the fact that some of the government organization, especially smart cities, municipal corporation, which had set up some level of integrated technology platform, like integrated command and control centers. They were the one who were able to manage, who were able to mitigate the challenge on the go. So, can you share how has been your experience in Kashmir in terms of managing COVID? What is the status right now there?
See, I think the way our country, India, has managed COVID, no other country has done. If you see the countries of the Southeast Asia and Southeast, any part of Southeast Asia or South Asia, you will see that COVID came back. There was the third wave, where there were issues on vaccination. There were a lot of other issues, but with such a large vaccination drive, free of cost to the people, which are so well organized right from its inception. I think it was the key to success. Right now, also, I would say that we have set a target that by November or December end, we should be fully vaccinated, and that has made a change. We see that the support of the central government, the coordination at the central level, the launch of the vaccination by the Honorable Prime Minister has been a successful program. It has been acclaimed internationally that India has fared so well during the COVID pandemic, especially since the vaccination has taken off. There are some states where issues were difficult to handle. They were very good. Kerala, Maharashtra, they were very good in the beginning, but after the second wave, because they suddenly opened and certain things didn't work well. But I think overall, if you consider the country at the large, we have done a very commendable job, and we have saved so many lives. So much oxygen is today available in J&K. So many oxygen plants are there in place in the hospital that we are having surplus of oxygen in the state right now. And we are thinking, if it is the situation is like this, we what to do with the oxygen. Honorable LG sir had a meeting recently asking what would you do with the oxygen if there is no COVID. You start thinking as to how you will utilize this oxygen. So saying that we have in J&K precisely, if I talk about COVID, we have sufficient number of COVID beds available right now. Oxygen is fully equipped hospitals with oxygen. We have vaccination drive is going so well that it has been appreciated by the Government of India, Ministry of Health, and wherever at whatever platform it was projected. I think COVID scene, I am proudly able to say that our country has done well, and our government of J&K has done par excellence. The way we have handled it has been very, very excellent.
Right, right. What we noticed during the COVID pandemic that one of the key challenge were that we did not have the enough integrated platform wherein actually you can identify the migrant who is coming from urban cities to their hometown. In healthcare, we do also see there are a lot of requirement of hospital information management system, and under the Ayushman Bharat digital mission, all those things, an integrated platform is being created. So how do you look at the role of technology? I'm just talking from a Kashmir point of view, Jammu and Kashmir point of view. What kind of efforts in the department you are taking that will enable a kind of different role for technology to ensure that the delivery of healthcare at the grassroots level is managed smoothly?
See, I'll tell you, I think the process of initializing Digital India, and which is a flagship program of the Honorable Prime Minister, is the key to all successful things in J&K. First time I want to inform you that J&K is on a e-office platform. First time, in 70 years, we are totally doing almost 90%, 95% paperless work. you know, and half of our secretariat is in Jammu and half is in Srinagar. And there is free flow of information, of data, everything, files are going from one office to another. So, if you relate this to how COVID can be handled, I think our COVID app, our Arogya Setu app, it has changed the contours of everything. We used to do all this on physical paper and physical plus and minus, but these days, the app will first register you. The app will tell you when to come for the second dose. You register yourself online at from home. Things have become so wonderfully efficient after the digital intervention in our lives that I think it is a colossal change. I see during my beginning of years in government and now that if you don't have your laptop, if you don't have your smartphone in your hand, if you don't have your tablet with you, you don't deserve to be in the system at all. You don't deserve to be there. So, so I think it is that Digital India has reached its zenith. I think specifically talking about my state and the UT of J&K, there is a colossal shift from, and it has brought transparency. It has brought accountability. Corruption and is at level zero right now in J&K. Nobody dares to keep a file on his laptop for long time. You cannot hide a file. You cannot take gullible people for a ride. Those days are over. you know so in fact, we are wanting, we our additional chief secretary, my boss, he is very keen to have the e-office in our subordinate offices,
Right.
directorates, our medical colleges, and then we want a patient management system based on e-health, which where in hospital we'll have a registration. We'll have medical reports, records online, like they do in the private sector already.
Right.
We want to introduce it in a completeness, link it to our universal healthcare system. J&K is the only state which has a universal healthcare scheme in addition to Ayushman Bharat. Honorable Prime Minister has been very kind that we have a universal 5 lakh cover for a family in J&K for the entire family, and there is no premium for that. Any member, any age, 5 members, 10 members, as many members there are. There is a golden card issued to you, and you get cashless, treatment in around 24,000 hospitals, government and private across the country. So I think integrating digital health and having a health insurance scheme of the level of Ayushman Bharat, I can't tell you how much immense happiness it gives me that we have been able to attain, that level of confidence for a poor man, that if he falls ill, he will not go bankrupt. He will not have to borrow money. He will, by that golden card, go to any hospital and seek medical advice and treatment. It is
Right.
it is a huge transformation of healthcare in J&K.
Right, absolutely. So, I mean, having an integrated technology-driven platform is one thing, but other thing which is very critical for providing a great healthcare service is to have a qualified doctor, a qualified paramedical staff, and there the role of medical education departments comes in. And what we have observed that there are a lot of states, including Uttar Pradesh, different states, they are announcing that they are setting up, new medical colleges. Just to increase the number of medical professional. How that thing is happening in terms of the medical professional capacity building in Kashmir? Uh, are you working on it? What is going on that?
5 new medical colleges have come in here, in a span of just 2 years, 3 years rather.
Right,
Number one, our nursing colleges have gone 3 times. You know, we have DNB, Diplomat of National Board, DNB, which is equivalent to an MD. We have 230 institutions, seats in various institutions of our UT, where doctors are now seeking, they are going for MD courses. So we are having the process of training doctors as specialists. Meanwhile, we had around 1,000 posts of doctors referred to the State Public Service Commission for filling up recently last year. And we have preferred that the doctors of the younger lot who come into service have to serve in peripheral areas necessarily for a couple of years in the beginning, and then they can go for training for PG, for DNB or wherever they want. But after having once you said medical education, it's a very important sector in health. It is not only health. Medical
right,
education is a continuous process. Every doctor should get trained every and each time. It's not that he did MBBS and he forgets medicine. That's not how it happens. He has to continuously evolve in the medical field with the new advancements, with the new medicines and everything. So that is the aim of the government, to train doctors, to keep them, in the stream of continuous medical education, continuous improvement in their skills, so that they can treat the diseases in newer methods. We are going to a level of even telemedicine these days. We have a telemedicine network in J&K where we are, in a remote area of Kashmir. If we have an X-ray or any investigation you want to get examined, it will go all through and across to specialists wherever you want across the country and get a specialized opinion on that. So, I mean, medical education is a very important area for the government right now.
right. So you mentioned a couple of things quite interesting. One is the telemedicine, and earlier about the digital India and the kind of impact digital India has on different government services in terms of the delivery of services. But in digital, there is a very important and critical piece, which is connectivity. And what we observe, especially in areas like Jammu and Kashmir, northeastern region, and even in some of other areas, I mean, in Odisha down the line in KK region, there is a challenge of connectivity. The last mile connectivity is still a huge challenge. So how the connectivity part is being addressed, and what is your observation? Because you have been part of Jakeja also in the past, you have done couple of e-governance project. So how do you look at the status of connectivity right now, given the fact that you mentioned about the e-office project, wherein e-office now you are planning to take it to at the subordinate level also. So how is connectivity status there?
I think connectivity is the base for all what you start. When you started to perceive or to conceive a e-health initiative or digital initiative, you start thinking of how you will connect that area. And I am proud to say that J&K has lot of agencies which are right now, supplying bandwidth to you. The last mile connectivity, as you said, we have connected the last PHC, the last health center, to our network, and we have different either government sector or private sector bandwidth providers who connect people. We have even optic fiber going to all districts of J&K, where from we are connecting, having this connectivity. And I think we are already onto the project of giving tablet phones to our ASHA workers,
Right.
and there's a training of ASHA workers going on, whereby ASHA workers will be empowered and trained to use a tablet so that she can transfer all data to her offices and put in all the data from the her mother, from the child, from other patients, which she goes and explores in her neighborhood, and the database will come through that basic tablet which that ASHA worker is going to initiate. So connectivity has not been an issue. Where I sit in the secretariat, we have high level of connectivity available here. Our Jakeja and IT sector people have done a good job by providing us connectivity right from the secretariat to the subordinate offices. And most of our meetings have been on now virtual mode since the last 2 years, and beautifully conducted. Everything, nobody has to move from Srinagar to Jammu or district headquarters. All the district magistrates, collectors, our administrative secretaries, they sit on, LG sir is taking meetings, of course, almost every day. There are 1, 2, 3 meetings on the virtual mode going on. So it is a continuous process now, and it has clicked and it is going on very well.
Right, right. We are in the last leg of the discussion, so I'll ask you a couple of questions. Based on your experience, what are the major challenges that do you see when it comes to the good governance? You mentioned about technology is doing great. You mentioned about the capacity building happening in medical education. Also, how the connectivity part has improved within in JNK. So, what are the major challenges that you see that the state is still need to address? I think we are facing some technical issue with Mr. Shafqat Khan. Uh, yes, please go ahead. I think you are not audible. We are not able to hear you. Yes, you are audible
Can you see
now.
me?
So yes, yes, please go ahead.
So, so I think if you talk about good governance, you will have to digitize your, basic work. You have to digitize your files, your letters, your correspondence has to be digital. Your land records have to be digital. Revenue is a very basic element where there are problems. Revenue records have to digitize. Then issuance of permissions, issuance of passport, issuance of Aadhaar card or iCards, whatever it is. It has to be online. It has to be customer friendly. The interface between a citizen and the government has to minimize. It has to be single window clearances wherever you go for a job. It doesn't have to involve you to talk to people, to beg people for your work, and timelines have to be given to officers at all levels for clearing their files, their data, or their grievances. So that will pave a way for an accountable, clean, free of nepotism, free of corruption, and free of malice towards anybody. So we will be able to give good governance to people. And I think most of the time which we spend in offices on file should be divided between the office and meeting people. We should have a physical interface also with people. Wherever there are people who are aggrieved, who cannot come on a digital platform to you, they have to be addressed from the virtual platform or physical platform. You have to go to people, talk to them, and that is what people expect. That is what a citizen expects you to do as an officer, as sitting on a high pedestal on a chair, that you come and solve his problem. That is all what he expects. He wants to be a happy person, and he wants his problems to be solved in a simpler manner. When he leaves his home, he should be able to get his issue solved in a very simplistic manner, not by complicated, processes, complicated file making, complicated going from one office to another. I think if you look at the digital part of it, I think at a part in time, we will have to integrate all databases, Aadhaar database, driving license database, healthcare databases, so that we have an integrated database of information about everything based on a knowledge sharing platform that will support our decision making process. It will make things very simpler for citizens, and all what you do has to be seen from the citizens' point of view. You have to see
Right.
how simple you can make a process for the citizen.
Right. No, you are absolutely right that the good governance will be absolutely when we have identified the beneficiary and we know the benefit that they are supposed to get, and the government should go and deliver that benefit at the doorstep. And there, actually, the technology can play a very important and integral role. So you are absolutely bang on and
Absolutely.
right. Uh, Mr. Shafqat, we have exhausted our time. So thank you so much for being sharing your thoughts on as to how you started your career in government, the role that solid waste management played in terms of your understanding of the issue, also the technology project that you worked upon in Jammu and Kashmir in various government department, and then some of the good thing that is being done right now with the medical education department in terms of the capacity building, in terms of having a continuous learning process for the doctors, and some of the good work which is done for mitigating the challenge of COVID-19 that we all have uh, gone through, and your views on the challenges faced by the government organization to deliver good governance and how those challenges could be mitigated. Thank you so much for your time, sir. Thank you.
I congratulate you guys at ET also that you're doing a very wonderful job, and keep that wonderful job up. Thank you very much.
Thank you. Thank you, sir.